To help us view the internal structure of objects, including our own bodies. The typical X-ray machine, like you get in a hospital, works by firing X-rays through a person's body and recording the ones they get through using a detector plate. This works because X-rays will be absorbed by dense materials like bones, but will be able to pass straight through the parts that are mostly air, like our lungs and intestines. And they'll only pass partially through the fleshy parts, like our heart. One of the odd things with X-ray images, though, is that the images start off completely white, and only go black if that area of the detector plate receives radiation. So it's actually the dense areas, like bone, that appear white, while pretty much everything else is either black or a shade of grey. We use X-rays to detect broken bones and other diseases, and although they do give the person a small amount of radiation, which can be harmful, it's generally such a low dose that it's worth taking the risk. It's also a very quick and cheap test. The danger is much higher for the staff involved though, and so they generally wear lead aprons to stop the X-rays and leave the room when the X-rays are being fired. If we place certain radioactive isotopes inside a person's body, which we can do by injecting them or getting the person to swallow them, then we can actually track the movement of the isotopes around the person's body by tracking the radiation that they emit. This means that we can check if particular organs are working properly by seeing if they absorb the right amount of the substance. For example, by giving people iodine-123, which emits gamma radiation, we can see if the iodine is being absorbed by the thyroid gland like it should be, because if it is, then we'll be able to detect the gamma radiation. We tend to use gamma rays for medical tracers because they are less harmful than alpha or beta, although we do sometimes use beta radiation. We also want to use isotopes with as short a half-life as possible, so that they only emit radiation for a short period while we take the measurements, and then they stop being harmful. So as we've seen with radiotherapy and medical tracers, radiation can be very useful, but it is also very harmful. So whenever we use radiation, we have to weigh up the risks against the benefits. For example, using medical tracers can help us diagnose diseases, so it's generally well worth the risk if we're already suspicious that a person might have the disease. However, we still want to minimize the risk by giving a low dose with a short half-life.